Most owners know chocolate is bad for dogs. That piece of information has been distributed widely enough that it has become the one thing almost every dog owner carries. What most owners do not know is that chocolate is not the most dangerous item on the list, and that several of the foods that cause the most serious harm in dogs are things that appear on ordinary dinner tables, in ordinary kitchens, in the ordinary course of treating a dog you love with something from your plate. The harm is not always dramatic. That is what makes this list worth knowing. Some of these work slowly. Some work in ways that are cumulative, building damage across repeated small exposures that individually look like nothing. By the time the problem is visible, it has been running for a while. 8 foods. Each one specific, each one present in enough ordinary households to be a real and current risk. Not to produce fear, to produce the specific, accurate knowledge that changes what goes into your dog's bowl and what does not. The first is grapes and raisins. No amount established as safe. No mechanism fully understood, no reliable predictor of which dogs will have a severe reaction and which will appear to tolerate it, which is precisely what makes this one the most dangerous item on the list, more dangerous than chocolate in some respects, because the unpredictability removes the margin of error that a dose-dependent toxin at least provides. What is known is that grapes and raisins can cause acute kidney failure in dogs, that some dogs have eaten them repeatedly without apparent effect, and then had a severe reaction, that the concentrated form, raisins, dried fruit, grape juice, products containing either, carries a higher risk per g-ram than fresh grapes, but that fresh grapes are not safe either. The only appropriate position is complete avoidance. Not careful moderation, not watching for symptoms. Complete avoidance, because the specific dog in front of you may be the one for whom a small amount is the amount that matters. The second is onions and garlic in all their forms. This is the piece most owners miss entirely. Cooked, raw, powdered, dehydrated. The processing does not reduce the toxicity. In some forms, it concentrates it. Onion and garlic damage red blood cells in dogs through a cumulative mechanism, oxidizing them in a way that reduces their ability to carry oxygen. A single large exposure can cause acute toxicity. Repeated small exposures. The dog who gets table scraps seasoned with garlic, the dog whose food contains onion powder as a flavoring ingredient, build damage across time without any individual incident being large enough to produce an obvious acute response. The clinical picture, when it appears, is anemia, lethargy, pale gums, reduced exercise tolerance, breathlessness. By the time it is visible, it has been developing. The gap between the exposure and the visible consequence is the gap in which most owners are unaware that anything is accumulating. Check ingredient labels on any commercial food or treat that lists seasoning. Onion powder and garlic powder appear in more products than most owners expect. The third is xylitol, the artificial sweetener present in sugar-free gum, in many peanut butters, in certain baked goods, in some medications, in a growing range of products where it appears on the ingredient list as a sweetener rather than under a name that any owner would recognize as dangerous. In dogs, xylitol triggers a rapid and significant release of insulin, causing blood glucose to drop to dangerous levels within 30 to 60 minutes of ingestion. It can also cause liver failure at higher doses. The amount required to produce a severe response is small. A few pieces of xylitol containing gum. A significant amount of xylitol containing peanut butter. Peanut butter, specifically, is worth checking because it has become a standard vehicle for giving dogs medication, stuffing enrichment toys, and delivering treats. And because the xylitol-containing varieties are present in mainstream retail, alongside varieties that are safe. Check the label every time. The word xylitol is what you're looking for. The fourth is chocolate, because it deserves accurate information rather than just general avoidance. The toxic compounds in chocolate, theobromine and caffeine, are dose-dependent and type-dependent. Dark chocolate and baking chocolate contain significantly higher concentrations than milk chocolate. White chocolate contains negligible amounts. The same weight of dark chocolate is considerably more dangerous than the same weight of milk chocolate. A large dog who eats a small amount of milk chocolate is in a different situation from a small dog who eats a bar of dark chocolate. Both are situations worth monitoring. Both are not equivalent. The symptoms vomiting, diarrhea, increased heart rate, muscle tremors, seizures in severe cases appear within hours. If the exposure was recent and significant, a call to your vet or animal poison control is appropriate. If it was small and the dog is large and the chocolate was milk chocolate, monitor carefully and know what to watch for. The fifth is macadamia nuts. Less commonly known than chocolate, more consistently toxic than most owners realize. Macadamia nuts cause a specific and recognizable clinical syndrome in dogs: weakness in the hindquarters, vomiting, tremors, elevated temperature, within 12 hours of ingestion. The mechanism is not fully understood. The response is reliable enough to have been documented consistently across cases. Macadamia nuts appear in cookies, in trail mixes, in baked goods, in foods that might be shared without the owner registering that macadamias are present. Knowing the name, knowing what they look like, and knowing they belong entirely off the dog's menu is the complete intervention required. The sixth is cooked bones, not raw bones, cooked bones. The cooking process changes the structural integrity of the bone, making it brittle in a way that raw bone is not. A cooked bone does not bend under pressure the way a raw bone does. It splinters. And the splinters, sharp, rigid, capable of piercing soft tissue, can cause lacerations in the mouth, the esophagus, the stomach, and the intestines that range from painful to life-threatening. The image of a dog with a bone is culturally so embedded that the danger of the cooked version is genuinely surprising to many owners. Raw bones, given appropriately and supervised, are a different matter that is worth a conversation with your vet. Cooked bones, the bones left over from a roast, the chicken bones from last night's dinner, belong in the bin, not on the floor. The seventh is alcohol, including foods that contain alcohol in any amount, including unbaked bread dough, which produces alcohol as the yeast ferments in the warm environment of the stomach. Dogs process alcohol significantly less efficiently than humans. A quantity that a human would experience as mild produces a more significant response in a dog, affecting coordination, producing dangerous drops in blood sugar and body temperature, and in larger amounts causing respiratory failure. The bread dough risk is less known than the alcohol risk, and more practically significant. A dog who has consumed raw bread dough is a dog whose stomach is actively producing alcohol and expanding simultaneously, both of which require veterinary attention. The eighth is the category most owners consider least: foods high in salt and fat, not as an acute toxin, but as a chronic one. High-fat foods fed repeatedly, the fatty trimmings from meat, the rich table scraps, the fried things that seem like small indulgences, can contribute to pancreatitis in dogs. An acute episode of pancreatitis is painful and serious. A dog with chronic pancreatitis from repeated exposure to high-fat food over years has a condition that affects her quality of life in ways that compound across time. High-salt foods contribute to sodium toxicity in large amounts and to increased blood pressure and cardiovascular strain over time in the pattern of regular exposure that most owners do not think of as risky because no single serving produces an obvious acute response. Behavioral observation of dogs with diet-related pancreatitis and cardiovascular disease has consistently found that the history involved the kind of casual, well-intentioned feeding of rich human food that owners did not register as cumulative harm. No single meal was the cause. The pattern was the cause. And the pattern is changeable once the owner knows what the pattern produces. The generosity that produces the shared meal is real. The love behind the table scrap is real. None of this is a case against treating your dog. It is a case for knowing which treats carry risk and which do not. So the generosity lands safely. She cannot read an ingredient label. She cannot know which bowl contains xylitol and which does not. She cannot protect herself from the things on this list. She is entirely dependent on you to know them and act on them. You know them now. Was there anything on this list you did not know before watching? And has there been a close call in your household that made you more careful? Tell me in the comments. And if your dog has ingested anything on this list recently, please call your vet or an animal poison control line now, not after you finish this video. Now, if this is the kind of watching you want to keep doing, subscribing means the next one finds you.